Welcome to my channel Learnovate. In this video, we will going to discuss about the anatomy of the diaphragm, and we will also going to discuss the structure of diaphragm, the structures that passes through the diaphragm, and we will also going to discuss the movement of the diaphragm through the inspiration and inhalation or exhalation. So starting from the position of diaphragm and what is the diaphragm between the two cavities. What is the role of diaphragm we are going to discuss. So if we consider this diagram, it is shown in a schematic view that this is the diaphragm, that is a musculotendinous partition between the thoracic cavity and the abdominal cavity. So here you can see the position of diaphragm between two cavities, and it is separating the thoracic cavity from the abdominal cavity. And why we are saying it a musculotendinous partition? Because the central tendon of diaphragm is formed from the tendinous part, while that of the domes, these are the domes right and the left dome of the diaphragm that are formed from the muscle fibers. And there are certain structures that pierces the diaphragm from posterior and from the inferior end to enter into the anterior abdominal wall. So actually a diaphragm is a partition, and at the right screw of the diaphragm or the right dome of diaphragm is upper border is formed from the right lung, but here is mostly the presence of the inferiorly there is a presence of the liver on the right side. That's why this is an appearance of the elevated part because of the presence of the liver inferiorly, while the left dome of diaphragm faces inferiorly the stomach. The fundus of the stomach is facing the left dome of the diaphragm. The central tendon of the diaphragm is the depressed area in the center because of the pericardial cavity. So the pericardial cavity will cause the central tendon to depress and become flattened. That's why the diaphragm appear in the dome shaped manner, and that's why this is the position of a diaphragm between the thoracic and the abdominal cavity. Now we are going to discuss how the diaphragm is seen from the inferior view if we take a coronal section, and what level the diaphragm is at. So this is the inferior view of diaphragm that is formed from the musculotendinous partition. This is the central tendon part of the diaphragm, while that the lateral side are attached with the muscular part of the diaphragm. The ligaments from the muscular and the central tendon of diaphragm are going to pass connecting the diaphragm to the lumbar vertebrae, and these vertebrae are connected by the ligament that are called as the crus of the diaphragm. Because they are leg-like appearance, so they are called as the crus of diaphragm. So the right crus of diaphragm, this is the right crus of diaphragm that is going to pass from the L1 vertebrae till the L3 vertebrae and connects with the median ligament and the lateral ligament towards the diaphragm. Then the left crural ligament attaches from the level of L1 till the L2 vertebrae, that is going to attach the diaphragm with the lumbar vertebrae. Along the sides of the vertebrae, here you can see these are the sympathetic chains that are running and may supply the diaphragm. Now coming to the median ligament of the diaphragm. The median ligament of diaphragm is an extension from the crus of diaphragm. Here you can see this is an extension from the crus of diaphragm that is going to cover the upper border of the aorta. This is aorta that is piercing the diaphragm at the level of T12. Now what happens? This aorta is covered with the median ligament, median diaphragm ligament. The median diaphragm ligament on its lateral side having a medial diaphragm ligament. Then on more lateral side there is a lateral diaphragm ligament. Now the one more ligament or one more fold of the peritoneum of the diaphragm you can see here is the extension of the right crus of diaphragm, and this extension of right crus of diaphragm will going to cover over the esophagus. This opening is for the esophagus that arise at the level of T10 vertebrae, and at the level of T10 vertebrae superior to the aorta, this esophageal opening is covered superiorly by the elongation of the right crus of diaphragm that covered it superiorly. So these are the few ligaments that we have to remember. The right crus of diaphragm that extend to cover the esophageal opening, the left crus of diaphragm, and the median ligament of the diaphragm that covers the aortic opening. Now here you can see this is the central tendon of diaphragm with the fibers arranged circumferentially. There is an opening in the central tendon of diaphragm is an opening of inferior vena cava at the level of T8 vertebrae. And superiorly here you can see this is showing the sternum xiphoid process, and these are the ribs at the level of the 12th rib. Here you can see these are the ribs here at the level of 12th rib. This is the diaphragm that enters into the crus and it attached posteriorly to the lumbar vertebrae. Now I hope this position of diaphragm is clear up till now. Now we are going to discuss the structures that are passing from the diaphragm opening and what are the levels they pierce. So these are very important to remember. So the first opening from the inferior, we can see this is the opening for the aorta called as the aortic hiatus. This aortic hiatus is at the level of T12 vertebrae between the two crus of the diaphragm. This was the left cru of diaphragm and this was the right cru of diaphragm that is approaching at the level of L3 vertebrae. So at the level of the T12 vertebrae, this is the aortic hiatus, and the aortic hiatus is between the two crus of diaphragm. With the aortic hiatus, the structures that pass is the thoracic duct and some of the azygous vein that drain into the hemiazygous vein or into superior vena cava also pass from this aortic hiatus from the posterior wall of diaphragm into the anterior abdominal wall. The second opening we can see is superior to the aorta, and this opening is esophagus that I have previously discussed. This esophageal opening or the esophageal hiatus is at the level of T10. With the esophageal hiatus, the structure can pass is the esophagus and the anterior and posterior vagal trunks of the lymphatic vessels and the veins. The esophagus is between the extension of the right crus of diaphragm. Inferior to the right crus of diaphragm, the lateral ligament of the diaphragm, this is an opening of esophagus at the level of T10. We should have to remember the level because they are very much important. T10, the aortic hiatus is at the level of T12. Now coming to the third opening, that is the inferior vena cava opening. That is also called as the Caval opening, and this inferior vena cava opening having the structure within is the right phrenic nerve also passes from the Caval opening. Also you can observe this Caval opening is more superior to the esophageal and the aortic level, so it is at the level of T8 vertebrae. Also this inferior vena cava opening is between the central tendon of the diaphragm, so this thing you have to remember. While these two openings, the esophageal and the aortic hiatus, is in the muscular part of the diaphragm. So I hope this will be clear. And now coming to the movement of diaphragm through the inspiration and expiration. Also the blood supply from diaphragm is mostly from the inferior thoracic artery and the nerve supply is from the phrenic nerve. Okay guys, here it is shown the diaphragm relation with the thoracic vertebrae. Here you can see these are the ribs from the T10 to T12. These are the ribs and the inside is the thoracic cavity. What happens during the inhalation when the air is taken in? What happens here is an increase in the anterior posterior diameter by increasing the thoracic cavity and by outward movements of the rib. Also, what happens to our diaphragm? There is a downward movement or the descending of the diaphragm to increase the area for the air to come in. You can say there is an increase in anterior posterior diameter and there is an increase in the vertical diameter, because this is a vertical dimension and this is an anterior posterior dimension. Because this is a 2D diagram, you can't explain well about the anterior posterior dimension. But when the ribs expand, there is an increase in the thoracic cavity, and when the diaphragm descends, there is an increase in the vertical dimension. So this occurs in case of the inhalation. Inhalation or the inspiration causes the increase in the thoracic cavity. The second case is the expiration. What happens during the expiration of the air? When the air is going out from the thoracic cavity, there will be decrease in the anterior posterior diameter and there will be inward movement of the ribs, or you can say the contraction of the ribs, causing the decrease in the thoracic cavity, anterior posterior diameter, and the diaphragm ascends upwards. It pushes the thoracic cavity upward and increasing the abdominal circumference. So by pushing the diaphragm upward, there is a decrease in the vertical dimension also. So there is a decrease in the anterior posterior dimension and there is a decrease in the vertical dimension. So the space will become less and there will be easy contraction and contraction of the diaphragm and the ribs to cause the easy passage of the air outside the thoracic cavity, and in this way the expiration can take place. So this is a process during the exhalation. Now I think you are cleared about this inspiration and expiration, and you are also cleared about the structure of diaphragm, that is the muscular and ileus sheath having the three openings, the caval, the esophageal and the aortic with the right and left crus having the level at the 12th rib. These are the crus, and there's an ascent of different structures posterior abdominal wall towards the anterior abdominal wall. I hope you will explain well about the position of the diaphragm, that is between the thoracic cavity and the abdominal cavity. If you have any query, comment below. Thank you for watching. Subscribe for more. Don't forget to comment below and give feedback on our Facebook page. Thank you for watching.